Welcome to Unwrapped with Tayo. This is a platform where we unwrap many meaningful conversations and ideas with extraordinary people. And today, I'm elated to welcome my boss, the Managing Director of SFH Access, Sir Dennis Aizobu. How are you doing, sir?
Very well. Good day, and how are we doing,
I'm
sir?
all right, too. Thank you so much for coming, sir.
Thank you, it's my pleasure.
So I'm someone who is really particular about foundation. I know that foundation is important to every great person. Please, can you tell us, where did you grow up and what type of home shaped your early values in life?
Where did I grow up? Right. So I grew up in Benin City. I'm sure a number of us know about Benin City. So many things happens, around Benin City. There's many stories, the good, the bad, and the ugly that people always say. But in terms of my home, so my parents were, my mom especially, I think my mom was stricter than my father. So I could say that growing up as a child, the person that would spank you the most or beat you the most was my mom.
Wow.
My dad, I could only remember one. But my mom was the one that made sure that you are in character, you are in shape.
Right.
Again, because she was more of the one who was more around, so she could know that you came back late from school today. You did not tell me you were not coming early. What happened?
Right.
And if you cannot define it, that's trouble. You come with... she's the one that people can say, I saw your son playing football on his way to school.
Right.
And then she will be the one to really, really deal with you. So I think a lot of that provided a lot of shaping in terms of my life. Again, they also taught us Christian values.
Right.
So that also helped to shape my personality or my person and then what it has been. So that's my growing up.
That's great. That's awesome, sir. So at what stage in your life did you realize or decide that healthcare was going to be your life's work?
Okay, so I want to say that, times have changed and it's quite my time, I must say that is really a bit different from today. Right. So you could recall that when we're growing up, your children would name that this one is a doctor, this one is a lawyer, this one is an
accountant.
Engineer. So I think growing up, I had that tag from my parents and people because I think I was intelligent. Right. Let me use that. So they said this one was going to be a doctor.
Yeah.
But things changed as I grew up and why I now had to study pharmacy.
Right.
I could say that there were three significant incidents that caused that. One was the fact that by the time I got to SS3 going to university, I realized that I could not handle blood. So of course you can't be a doctor if you can't handle blood. So even till recently, I can't stand a pool of blood. So I have phobia for blood. The last one that almost happened, my wife had to quickly come and jack me up. So it would be as if I want to faint. So I think that was one. So what was close to it, the next issue was that we had around us that time, I had a couple of well-respected pharmacists in Benin. So one was late Sir Samuel Agboifo, who was the MD of Edo Welfare Chemist, and he was a renowned pharmacist globally then. So because he lived close, he lived a quiet life. I felt he was rich, so let me use the word. So that was also that, and then the third one was, so my dad, before he passed on, was into printing. So he had a client. He had two clients he was supplying. One was Nomagbo Pharmacy, still alive till today, and Nomagbo is still today. And the other was Best Bet Pharmacy. So I just liked the setting, So when I asked, of course, this didn't require blood. And then the third incident was now very personal. So growing up, I didn't see my mom, my dad. In fact, up till my dad died, I never spent a day in the hospital. So I was those kind of people that didn't grow up to see anybody sick. But when I got to secondary school in 1988, I fell sick. Right. So I would say I was the first to be admitted into the hospital. And I was always in and out of sickness, up to an extent that when I wrote my JAM, immediately I was sick before I went in. So it wasn't too obvious to people, but I knew that I was sick. And so when it was finally at that point where you had to make the final choice, I also felt that I should look at what will help others who are going through my challenge, because I felt that access to medicine was a big issue. So these three issues, the issue around blood, the issue around people who were around me then, where I could say Sir Sam Agbenfo was seemingly one of the most successful people around me then in the medical profession, in the alternative to medicine profession, and then my personal episode around in and out of having headache today, maybe after a week later you have body pains and all of that, and I felt I should come into this field. It may help. So those were the three decisions that I could say made me
decide that healthcare would be your life's work.
When the alternative, this was the route to
help yourself and to also be able to help other people.
Yes, and at least I will not touch blood.
That's amazing. You know. Okay, so as a young professional, what shocked you most about Nigeria's healthcare realities?
Okay, so I could say several things made healthcare realities a dawn to me. One was, every young man, when you're going to university, your aspiration is high. Maybe when you enter, some realities will begin to dawn on you.
To reveal.
So I was fortunate that those realities dawned on me early. Some part of it, not all. One was the fact that because as a student, I was also very active in the departmental politics. So that gave me the opportunity to go outside, talk to people, look for funds to do our faculty week, and all of that. So going out there and interacting with the professionals now started giving me a different light to what seemingly seems to different people, there are different realities. So to a particular group, their realities was a bit different. So that was one. The other issue was also, again, when I did talk about my bout of sickness in secondary school.
At school,
Yeah, that when you go to, particularly one of the first time I was admitted was actually when I went home to see my grandmother in the village. And you now realize that we didn't have enough manpower at that point in time. So being on admission, one person was always pursuing all of that. So that brought reality. But as I grew up and began to meet people, the other reality that began to anchor was again the fact that we didn't have what we call a system to help people pay for their medical bills when they are sick. So you see a family who once somebody is sick in the family, it drains the entire finances of the family. That's again because we don't have an insurance system in this country. So those were it. So you could see facilities, and it wasn't too good. But again, it was fairly okay in the South at a point. Remember that at a point we had a lot of Japa syndrome. That's
even till now.
Yeah, so it's always a cycle. So that there was, I think, I remember when before I got into university, every medical person in Nigeria was going to Saudi. So if you meet these days in Saudi Arabia, this doctor, this pharmacist, this nurse. I had friends who were in secondary school, their mothers were all nurses in Saudi Arabia. But the worst for me was when I went to serve. And then it now was so done that some of the things that I thought were not enough for me, for those of us in the South. By the time I moved
to other parts
of the country, it was actually not in existence. So you could now see that if I had a friend that where he served, each time I go to visit him, I get moved. So he served in a place, I don't want to call the name of the local government or state. So
you may.
So he served in a local government area where, as a copper doctor, he was everything. Sometimes there was no light for him to even do those minor surgeries that he needed to do. And so when I go to visit him, the reality of how how the depth of what was happening.
Right.
Because within the urban area, you have choices. You could move from a government teaching hospital to a federal medical center, even though we didn't have too many federal medical, but I think we had state specialist hospitals then. And then there were private hospitals for those that could afford it. So, like I said, you realize that there's a lot of disparity between some part of Nigeria, the south especially, and the north. And then even within those places, there's a huge disparity between the urban area and the rural area. In fact, it was so bad that I remember one time I went to, this was another state, and I went to that primary healthcare center. They were rearing they were rearing chicken and goat inside the PHC.
The same space?
Inside the PHC. So one of the, I think it was a four room or 5.
Okay.
In that PHC. One of the rooms was for rearing.
Oh, yeah, like a primary healthcare center. Yeah.
So they were rearing fowl and goat. And yet, the person who was the most skilled healthcare worker there was what you call a community health extension worker. So those realities actually shaped some of my thoughts, some of my work, and some of our contribution to the healthcare. We might be a bit carried away because some of us who have access will think that we think that what we have
is it luxury in some people's
but it's actually luxury
in some people's reality.
In some people's reality. And if you are not out there in the field, you may not understand the depth of some of these things. I mean, if you live around where we are doing this program right now, you have some of the best of doctors around here. You have some of the best of hospitals around here. But just drive maybe, I don't know this, but just drive maybe 1 hour away.
That way.
down that way. What you will see will completely change. So for me, those were some of the things that changed my mind and why I now felt so. Experiences as a student in the university, experience when I went to serve, made me begin to look at issues around public health and how we can use primary healthcare to solve some of this problem.
All right. So is it safe to say that healthcare problems are more about systems than medicine?
So I think, no, healthcare is an integrated issue. So there's the issue around system. There's the issue around structure. There's the issue around manpower. Even though we have it, but it's concentrated in some basic area. There's the issue around the necessary support equipment. So for a patient to have what you call a definitive diagnosis, the doctor has a team of healthcare professionals working around, including medical lab scientists, including radiographers, radiologists. Now, if you don't have those equipment to do those things, your what you may prescribe may be just be assumptive sometimes. On the issue of drug has our own issues, particularly because it's so sad that we're also in a country where people think that drugs are biscuits. So you see people selling it, hawking it. But actually that's wrong because for every drug you take, what may be a healing to somebody may actually be a poison
damaging to another
person. And so we see it from what we call a chaotic distribution point of view. But you also see it from what you call a lot of counterfeiting in Nigeria. So the counterfeiting market or economy is becoming so big. That people are actually taking, people who don't get drugs from the right source are actually not taking what they're supposed to take. So you could see that why you don't have equipment to diagnose, even when you have access to drug and you're buying from the wrong place.
You don't know if it's expired or it's not good for you.
Then if you also go to facilities in certain areas where they don't have the kind of skilled manpower, the person that is treating you does not have the capacity to actually do that. So that's why you find out that in most cases in this country, a lot of the people, when they show up in the hospital, significant numbers actually at a point where you have to use faith.
Wow. May God help us.
Amen.
Yeah. All right. So can you tell us in plain words, what does SFH Access really do? What do we actually do at SFH Access? And what are the problems it's trying to solve?
So SFH Access, like maybe if you, but not maybe not so many, is a subsidiary of Society for Family Health.
Okay.
And a number of people may know Society for Family Health, but I'm sure significantly you know a lot of our products. The one that is most popular is Goat Circle Condom, which everybody knows, and Postino 2.
Right. Topma,
the
Water Guard.
Water Guard, and all of that.
Yeah.
Now, our vision has always been to look at life, enhancing life. It has always been health and well-being for all.
Right.
So initially, we're always looking at the poor and vulnerable. Now, our tag along the poor and vulnerable was simply based on the fact that there was already a huge issue. In fact, the issues we talk about as a country today has always been in existence. But nobody has been able to understand that for you to deal with it, you need to unlock the vast majority that are under that challenge.
Right.
So you have a population of rural, urban spread of maybe 60-40,
Right.
with 60% more in the rural area. And you have more population in the rural area, but they are more disadvantaged.
Right.
And because they are more disadvantaged, there's what you call, there's no access.
Right.
2, there's no equity. So what why SFH Access is to use our experiences, our mechanism, our know-how to bridge what we call that access equity gap. So in the way we do things, we believe that everybody, whether poor, middle class, or rich, should have access to the highest of all quality.
Right.
So what we do is we do what you call cross-subsidization, and then we work with partners to ensure that if Mr. A needs to get anti-malaria, for example,
Topma.
he should get Topma of the highest quality at a price that Mr. C, who is extremely rich,
can also get it.
So
the prices are subsidized.
Yes, to a significant extent, they're subsidized. Then the other thing we also do is to address what we call the determinants of health. So there are several factors that leads to good health. One is issues around hygiene and access to water.
Right.
So I'm sure you know one of our products called Water Guard.
Water Guard for cleaning your tank and all of that.
Yeah. So what we had looked at was that the urban water supply, when I was growing up, at least in my primary and secondary school, we could open the tap in our house and water is
drink from it.
And drink from it. We didn't have the luxury of drinking plenty bottled water like this. But as urban development continues to increase, the public water supply is shrinking.
Right.
So people don't have access to potable water supply in their homes. Now, that's even in the urban area where the public water supply is less than 30% of the population. In fact, every day is dropping.
Right.
Now, people are building houses, people are sinking borehole, people are providing water for themselves. Now, we are looked at a country. We are very rich in terms of water, but whether in terms of surface water or underground water. That's why you could do boreholes and there's water. And the whole of Lagos is water.
Right.
But if water is consumed that is not treated, what happens is that it now becomes a determining factor in how healthy people will be. So our work is to also begin to look at how to address those things. That's one of the reasons why we brought out our various water treatment solutions like Water Guard for peri-urban area, Water Guard tank floater for the very rich, and then Water Clear, or working with P&G to do what you call the P&G water purifier for the rural areas. That's because they get their water from the river, and once they fetch it, you know, the way the stream works, it flows from one community to another. In this community, they go to one place and say that's clean. They fetch clean one, but as it flows down, they wash their clothes.
It gets dirtier.
They do everything. So the water takes that down. But as it's going down, you know, the grasses would hold some of those debris. So by the time it gets to the next village, it looks clean. They will now go to the other source and say this is the source of the water. But we put this solution so that you can treat your water and become. So if you ask me on the nutshell, what we're trying to do is majorly one, to bridge the health equity gap. And then secondly, to also begin to address determinants of health. And we can do it in several forms. I just mentioned how we can do it with water and hygiene. Determinants of health can also be even looking at road road safety campaign and driving, because you remember once upon a time, particularly when there's too many Okadas flying on the express road, and you have a lot of accidents and
all of that.
I remember when I was doing internship, one of the nights, the work I dread the most is to be on call on a Friday night at the teaching hospital there, because you are sure that between Friday night and Saturday morning, and between Saturday night and Sunday morning, the number of people that will come with broken legs, accidents.
And you don't like blood.
So those were all some of the challenges. That's what we try to do.
Okay, so I know you've spoken about how Top Mile and other products at SFH Access are subsidized, and that's the reason why the prices are more affordable. I want you to please emphasize on Go Circle Condom.
Yes.
I want people to understand why Go Circle Condom, despite being a premium brand, but the price is affordable.
Yeah, so Go Circle Condom is one of our biggest brands at SFH Access. And the reason why it is because I've always said, if you look at the poor and vulnerable, is a huge population.
Definitely.
Now, you want to do what you call sexual health. So you want them to not only be healthy, you're also providing a means for them to
be safe,
to plan their pregnancy, and to have family planning in place. And so it was one of the reasons why we introduced Go Circle Condom. And Go Circle Condom is a premium condom. In fact, it's actually the only condom that gets into Nigerian market that is what we call double tested. So it's double tested in the country of origin.
Tested also in Nigeria.
Tested in Nigeria before it's released in the market. And it's coming from where you make, just name the premium brand condom in the world. Where it's being made. It's also
that's where we make Go Circle Condom.
Where it's coming from. But because we are positioning it so that what the big ones or the very bourgeois would use, the very poor and vulnerable will also have access to that, is why the price is that. So technically, we're actually subsidizing it. If we need to sell it at the price it is supposed to be,
it should be way higher.
Way higher. And so what we've also done, if you look at our array, sometimes people ask me, how come you're the one that distributes Go Circle Condom, you're the one that distributes Flex Condom, you're the one that distributes Lifestyle Condom? It's because Go Circle is for the poor and vulnerable, Flex is for mid-price, what you call the middle class. And then Lifestyle is for the higher class.
The high end,
All of these are all premium, but just different pricing for different segments of the market, so that everybody will have access. I know we are very particular about access. We're very big about access. And we would do anything within our power to ensure that people have access to the best of all quality. And I'm saying this to people who feel that Go Circle is cheap, Go Circle is low class. No, it's actually a premium condom, but just subsidized so that the poor can,
so that everybody's lives
can have
could be protected.
Absolutely.
That's amazing. All right. So at SFH Access, what particular achievement are you personally most proud of?
There are several achievements. So when you say one in particular, it doesn't negate other. But if you look at it, one is the fact that as we look at the healthcare landscape in Nigeria, the fact that first thing is that whatever we put out there has the highest quality. For me, that's one big achievement that I value a lot. Because I know that if you pick up our Go Circle Condom, if you pick up our Topma, if you pick up our Water Guard, if you pick up any product that we distribute at all, they are sure of the quality of it. That for me is one of the most particular. The other you could also see is that how we've also been able to create or what we call market shaping in Nigeria. And I will say it from three perspectives. When, as an organization, we started condom distribution, it was a taboo for people to talk about condom and use condom. But we've been able to grow the markets such a way that we actually allowed other people to come in and become players.
Okay.
So imagine where you were the only one, where we had a market share of about 90-something%, and you deliberately dropped so that the fact that we could have a lot of players, for me, is an achievement.
Right.
The second thing I want to talk about is when Nigeria drug policy changed from chloroquine to ACT, we actually championed how such a way that people could have access and people could afford ACTs in the private sector. That's what led to Topman. Okay. So that helped, because initially, I mean, people who record them, monotherapies were sold in their thousands. But the fact that we could help to bridge the gap that today in Nigeria, no matter what level you are, there are different prices for you. For me, those are some of the very, very remarkable achievements that we are proud of. Again, the consciousness that we are beginning to raise in terms of people understanding that you need to treat your water is not yet there. But the fact that people are now beginning to get that awareness that they can be their own, where we have made people their small water board for themselves. For me, those are very massive, remarkable achievements. As an organization, the fact that we've broadened our portfolio, we've grown into different disease areas. In fact, we started a partnership with a multinational, which was aimed before the forest issue, that people who have hypertension will treat their medicine with $1 in a month. Again, because disease patterns are changing. So we've also, if you look at the data, it's moving from communicable disease dispensation to non-communicable disease. Again, because people are living longer in Nigeria, because people are living longer as you age, diabetes and hypertension is becoming an issue. So the fact that we've been able to bring in some, despite the exit of the multinationals, that we have what we call non-communicable disease medicines that is able to deal with those issues. And you are sure what you are getting from it. Very, very affordable price. We are still working. It's not easy, but to ensure that those products are sold at $1 for a month. That means 30 tablets in a month. Because when you come to think of it, if a poor man out there has hypertension, the fact that he takes medicine every day that are expensive is even killing.
It's already going to kill him.
He's already dead. But
it's a dead man.
Because again, if you look at the income structure in the country, a significant it's a significant population in a very rural area. They live on daily income. So they have to go to work, clear the farm, they get paid. They have to gather their farm output and wait till the market day to sell. So they don't have a structured way where somebody pays for their medicine. So we need to create that system. And they get sick of malaria. They get sick of hypertension. They get sick of diabetes, all of that. So the fact that we've been able to introduce those products at those rates, for me, it's one of those things that I
you celebrate.
That I celebrate.
Yeah, that's great. You know, and I like the fact that we have many things to celebrate at SFH Access. Absolutely. A lot of achievements, and they will not stop. All right. So talking about achievements, through the Co-Elevate Catalytic Fund, you support early stage health tech startups. Right. So what is one thing that you think founders often underestimate when building in health?
Okay, so thank you. You know, for us, Co-Elevate, I think maybe just to backtrack, is also one of the success we are celebrating, but it's a way to help begin to catalyze and grow startups in Nigeria. So a number of the challenge around health founders is the access to capital. Now, as a country, your access to capital is quite high. So if you want to go for, people don't even know how to access capital. I think that's the first one. So, and there are several methods to gain equity. Now, the only one most people do is either to reach out to friends or family members. Now, if you don't have enough family members or friends who are wealthy, your ideas will die. So what we try to do is that we provide that equity opportunity, which is access to finance. But we also provide what we call the business support. Because a huge challenge with health founders beyond equity is also the fact that they don't understand business. Business is not just that I have an idea and I can produce, but you must move it from an idea to production to cash flow to managing cash flow and then sustaining the business. Now, if you can't move from idea to production, it dies. If you get to production, You need to know how to move it from production till it starts generating cash
Income,
flow and manage it. So we've looked at those pain points. We've looked at pain point of finance. We've looked at pain point of systems and structure.
Right.
So what Co-Elevate is also doing is that for people who are winners, who are going to get the grant, we are providing a training system for them to begin to understand marketing, understand sales, understand accounting. Because if you need to scale, it means that you need more funds. For you to get more funds, you need to have a proper accounting process in place. There are no investors. If you recall, one of the things I always tell people, nobody funds an idea. People actually fund results. And your result is only shown when you have your books.
Process.
That say, this is it, this is my process, this is what I've done, this is what I can achieve. And if you inject X amount into this business, we can take it to business level.
We'll be making 10 naira, but if you add this more money, we'll be making 100 naira.
So that's why if you look at our focus around Co-Elevate is what we call like a 4-prong approach. There's the approach around health tech, because we also believe that we must use technology to begin to bridge that equity gap. So technology could help us save a lot of manpower time spent in the hospital. Because the challenge for out-of-patient services and doctors are overwhelmed is that when you enter your clinic and you see like 300 patients,
you'll be tired.
You don't even know where to start from. So any health tech solution can do that. We're also using it to catalyze research and development in Nigeria. We're actually trying to also use it to bridge the gap between academia and industry. So the fourth component of it is drug research and drug development. So we have focus on non-communicable disease, we have focus on health technology, we have focus on water, and then we have focus on what we call pharmaceutical drug development. So we feel that there are tens and thousands of studies that have been carried out in several pharmaceutical schools in Nigeria. People are doing pharmacognosy, plant, and all of that. So we can begin to look at how to take what will move to the next stage and begin to support that process. Because the reason why it doesn't grow beyond textbook project paper is that a number of people just do it. I've passed. Either you have your first degree, or you're doing your master's, or you're doing your PhD. But we want to begin to, we have put in a process where people can take those research finding and see which one can go to the next level, and we are ready to support it. And the additional beauty of Co-Elevate is that it's not a one-off. So if you are successful and it's scalable, we can now look at how we can take it to the next level.
Awesome. I believe you've shared a lot of points in the factors that moves healthcare outcomes long term. Because there's a saying that say that soldier goes, soldier come, barracks remain the same. You are the barracks. You've seen funding, you've seen technology, you've seen policy cycles, go and come, but you're still here. All right. So, how do you balance urgency with patience, especially when lives are involved, but the system moves slowly?
So we actually have a very huge bureaucratic system in Nigeria, and the balancing is not an easy feat, but we'll still continue. One way we've tried to deal with it is to do what you call long-term planning. So in terms of long-term planning, that has helped us to be able to bridge it to an extent. So that's what we've done. But also, one of the things we've also recognized, and I think COVID taught all of us that in terms of urgency and emergency, once we get there, we have the convening ability as an organization to bring stakeholders and policymakers together. So if you look at COVID, when COVID came, those discussions and movements ensure that as a country, so many things were catalyzed to quickly scale. But COVID also taught us a lesson as a country. And that's the fact that we must take security is not just armed robbers not visiting you.
Even diseases are there.
We must think security
pandemic.
From a holistic point of view, from education, from health. Because one of the things that happened during the COVID pandemic was that the countries that were producing did not ship, and so you have supply chain challenge.
People now go die, make you die.
So it was, let's save our country first.
Right.
But it's a challenge. Things have improved slightly in terms of, because when it comes to a number of these factors, particularly us that deals on drug, remember that healthcare in the country is in the concurrent list. So that's also a problem. So it means that if you want to do anything within the healthcare, there's a federal, there's a state, and there's a local government.
Right.
But the drug is in the exclusive list. So drug is purely at the national level.
Okay.
So that also means that there are a lot of regulatory. And one thing you must also know, that globally, drug is one of the most regulated sector in the world. It's also one reason why people don't want to go into it, because you are a regulated product.
Right.
Your life as a practitioner
is regulated.
So, which is quite different from a number of industries where
you can freestyle.
Yeah, and then the additional thing that there are layers upon layers upon layers of regulation. So as a country, you don't only have one regulator. You have to pass like two. For example, if you want to bring in diagnostics, you go to NAFDAC, you go to Medical Lab Science, sometimes Standard Organization of Nigeria is there. So by the time you go through
all of this,
you're already tired. And it takes more than 2 years to deal with every one of these conclusively. So what we've done, like I said, is long-term planning in a number of cases, and that has helped us. Yes, we've fallen short on a number of times, but that has helped, and then the ability to also talk to policymakers. And so we've also seen that things have also improved slightly, particularly in terms of...
Are you okay, sir?
No, I'm fine.
All right,
particularly in terms of maybe clearing, or in terms of drug registration process, it's still very cumbersome. It still takes a lot of time. But I must give it to NAFDAC. They've tried in terms of using electronics to do a number of those things that would help. Because up to now, more than 50-60% of our drugs in country are still imported. At a point, it was like 70%. The country is driving towards changing that, and I'm hoping that all the policies in place, or the plans in place, if they come to materialization, we would witness a change, so to say. Just like you are beginning to see in terms of medical tourism, there's a deliberate plan to change medical tourism in the country, but there's a deliberate plan which a number of us are keen into and seeing how that will drive.
Well, we all pray it happens, because that's what is going to serve all of us well.
Absolutely.
And protect our lives, because at this stage, where as citizens, we're depending on people in the healthcare industry to make a great change, in how we can rely on our hospitals and pharmaceuticals in general. All right, sir. So would you say that your leadership at SFH Access has changed how you define success?
Yes. As a leader, there are several parameters you use to define success for yourself. So you define for yourself. You allow your stakeholders to define what's success for you. And then you allow the general population or your customers to define what's success for you. And so once I look at these three parameters, I as a leader would set my measure, my yardstick. And so that would help me define, are we doing right? Are we in the right direction? And the way we measure one of it is what's our health impact? And the way we measure health impact is how many lives have we saved? How many young people have we prevented from dying? How many pregnant women have we prevented from dying? So we have those parameters, and to me, that's a key success. How many liters of water have we treated?
Statistics.
Yeah, so we use that to measure our success on one hand. We also use the benchmark that is set for us by our stakeholders in terms of this is the direction we want you to go, and which include we want you to look at how to begin to respond to this particular disease pattern in Nigeria. Do you respond to this? How do you deal with that? So that's another one. But I think also importantly is how the consumers out there see us. So we are happier when somebody says, I used Good Circle condom, and I'm happy that I'm using it. We're happy when somebody comes and meets me on the way and say, your top man works.
For my malaria.
For my malaria, I'm happy. I'm happy when somebody comes and says, since I started treating my water, my frequency of going to the hospital,
or
has used
Pharmacy,
for
yeah.
pharmacy
Right.
or BPMVs to buy drugs
Right.
has reduced significantly. So those for us is what gives us joy.
That's your joy.
Maybe
Feedback.
that's why we can't jackpot.
All right, you can't. So please don't go. Okay. So, is there any belief that you used to hold dearly in healthcare that today you don't believe in anymore?
So I think maybe to say there are certain maybe growing up or in training practice things you want to hold on to. But as you look at what has transformed, I mean, whether you like it or not, from 2000 till date, technology has transformed a lot of things. And then we have also come to begin to realize that some of the, what I call the professional tough that we try to hold on to, a number of them are beginning to lose. Because one, information is out there.
Right.
So for people who go out there to read, but sometimes by the time they are talking to you, they seem to even have more information than you. And so for me, I feel that there are certain elements of the work or that out there that has changed. For example, I'm sure that's why those of us within the health sector, the government talks about tax shifting and tax sharing.
Right.
So we must come to face reality. And the reality is the fact that we don't have enough healthcare workers everywhere.
Right.
So how do we bridge that gap? So whatever system we must develop to put in place. I mean, in those days, a suicide or a professional taboo to recognize your rivals.
Right.
But now, those boundaries for me, even though regulation must take its place, but we must also begin to see how those persons in the community can help. So I think those has changed significantly in terms of my approach, in terms of how I see success and how I see things. The other thing that I must encourage everybody within the healthcare space is that it must see that we are a team and everybody is complementing one another. Because a lot of what you see or hear in Nigeria is because there's unnecessary professional rivalries. But if you look at it broadly, maybe because I sit on a broader platform, and that platform means that everybody within the healthcare space have interest in them. So that makes you see professionals as different. That makes you see their contribution as different. And that makes you also begin to look at how things work. I think importantly, we must prioritize primary health care, and whatever we need to do to make primary health care work,
we must make it happen. That's good. Thank you so much for sharing your knowledge, your experience, you've unwrapped your expertise, with us here, and you are such a great leader. Not just at SFH Access, personally, I can testify to your great leadership skills and gifts. But I would like to ask you, sir, is there anything else that you are struggling with as far as leadership is concerned today?
Struggle with? I think every leader will have one or two. So we can look at it from both at a macro level and at a micro level. So maybe when you look at it at a macro level, you also begin to realize that certain things has also not helped us as a country. So whether we like it or not, the effect of the Jackpot syndrome, it's actually telling now that you're looking for skilled manpower.
Country is drained.
So what has happened was that the very skillful ones moved. So once they moved, the others took the next level. Somehow, even though that next level moved, so you now need to start training.
So we're managing what is left.
And you don't, and to get to that capacity is time. I mean, nobody leaves the university today and can fill in those gaps adequately. They need to go through that process. So let's take production. We have a factory where we produce.
Definitely.
Somebody needs to be trained on quality control. Somebody needs to be trained on the production processes. Somebody needs to understand that SOP. Those are not things that you do in 1 year. So you could see in terms at the macro level, skilled manpower is
scarce.
It's scarce. So it means that it also means that you have to pay more
Right.
for the ones that are available.
That are here.
And in paying more will increase your cost. So you could see that it's a chain. I think sometimes we don't understand that we're all connected in one way. So it's a chain reaction.
Right.
And once you increase your cost, the supply chain outside there, they are getting it at a higher cost. They too will increase their cost. Ultimately, the client who will eventually have access to this is going to pay
Higher.
more. So you look at that from that particular point of view. Now, you'd also look at the fact that people also don't understand work and the sector that they play in. And that's a whole lot, you know. So you could have somebody in communications, for example, can work off-site.
Right.
But somebody in the factory cannot work off-site. And most times, the real employers of the economy in this country, about 90% of them cannot work off-site.
Yeah.
But the people that have the loudest mouth are the people who are able to work off-site. So you see, sometimes there's the trying to balance culture, trying to balance what I call values, and trying to balance, trying to make people understand the dynamics is a whole lot. So particularly with I said this particularly with the younger generation, because there's a lot of cultural adaptation you must do. So you must be able to tell the person, understand this process and timing. So you can see you have that timing issue, you have manpower debt, you have understanding the work culture and what it means to work and all of that. So you could look at that broadly at a macro level. Then you could also begin to look at least this year we've had, since last year, we've had stability. But in 2023, there was actually no stability. So as a leader, you were not sure whether you be in business. You need to be on top every day for you to be in business. And I said that any businessman that survived 2023 in Nigeria, we must give them kudos.
Wow.
Because basically you were living in an economy where every day your cost was going up. Dollar was going up, transport was going up, salaries
the policy is working against you.
So everything. But we've had stability for almost a year now. Yes, since February, March last year. We've had stability in terms of.
So are you saying there's hope of things getting better?
Yeah, I believe so. Now, if you look at even in terms of the latest reports, Nigeria is at least one of the things you could say that we're one of the biggest contributors to GDP that will contribute to GDP. So it means that if we get the things right, if we get our processes right, if we get our systems right in this country, to be honest, I've traveled far and wide. So the way to look at Nigeria is to look at Nigeria from an economy. What we have tapped is a scratch. So you must look at it from so we have potentials, but we have not
dug deeper, you know,
potential. So and there's a whole lot. What we've just done is small. Okay, so let me even talk about the entertainment industry. Growing up, the kind of music we had. We're all listening to foreign music now. We're all singing foreign music. In my time as a young man in secondary school, we can't sing Nigerian music. They were not. They were not even sweet to the ear. Reggae, other hip hop, everything was foreign.
Rock.
But see what has happened. I mean, the last time I was in Australia one time during the female World Cup. Once Nigerian music started, the entire stadium erupted.
That's it.
So I've been to a lot of countries. Once your music is on, people are dancing, people are singing.
That's it.
In fact, we've changed the culture entirely across Africa.
That's it. Across the world, the globe.
So that's just one sector that has been unlocked. So imagine that what our banking sector is doing. There's actually no country in West Africa and a lot of Eastern Africa that is not our bank that is driving what's happening. So I just mentioned two. So imagine if we unlock health. Imagine
banking,
if we unlock food.
Education,
not even education. Fashion and we own. So it just tells you what
tourism.
Tourism, we are not even doing.
We are not serious with this yet.
So it just tells you, just see what has happened with Dirty December. That's even Nigerians coming back. And see how it has changed the economy. So imagine if we blow that product.
Make it really,
then particularly we now have a safe country. People come in. You can imagine the quantum of you see, when you look at it, you don't only look at it from one man's idea. We look at the various service support, the boatman, the hotel, the recharge card,
food vendors, restaurants,
the food vendor, the recharge card, the data that they will buy to make those calls.
Even all these local tourist sites like Olumoro and all these places.
The tip they will give. So when you look at that whole economy, is when we unlock it. So that's but if you now look at from a micro point of view, challenges, yes, there are a few times, we could have done this better, we could hit this target.
But we are getting there, we're growing.
But we are growing.
Gradually.
I think
Thank you so much. Thank you. That's good. I feel better too, that you're talking about hope. I needed that.
No,
yes, sir.
There's hope. I think that there's hope if we decide to
make it happen.
Right now we speak the language. If we execute, there's hope. I think that ability. That's why I gave you the entertainment industry and the banking sector. Just a reform that Obasanjo started. Took all our banks outside, and we're employing people everywhere, including Nigeria. Just a reform that a group of people started in 97, 98, when all those started changing our music. Now, globally, our music that we're even nominated for Grammy and everything. In those days,
we can dominate the world.
In those days, what's your business with Grammy?
That's true. Thank you so much, sir. So, lastly, what advice would you give to young professionals who are entering health? Maybe you've said a lot of things. Passion is not enough, but I believe that you would have an advice for them.
So, my counsel to young professionals will be in several forms. One is to understand that with health, you have to be a bit patient. So health is not the reward from health is not instantaneous. And then because we live in a society where say for example, you graduated with somebody, I don't want to mention any course, but if person can just come and blow. And then the process for you to become an expert where you are a bit more comfortable with Kumba, so it takes a whole lot of time training. That demands patience. So for young people, it's patient. I think what's also important for us to understand is it being broad-minded enough. So sometimes when I look at a number of young people, our minds are, the training narrows your mind. And so what I tell people is that your first degree is a platform. Now you need to unwrap yourself, or else you will just be stuck in what has faded away or what does not exist anymore. But your ability to have an open mind makes you now realize that everybody's important. So that open-mindedness, that ability, health workers must now begin to transit from just being behind to be more interactive. Because that's where you get the information. Because what has happened before now is that you sit in your hospital, the patient will come. If you're a doctor, if you're a pharmacist like I am, you think you stay in your pharmacy, they will come and buy.
They will come and buy drugs,
pick the drug. But that's changing. You need to be more interactive. You need to be more understanding of what others. So the younger ones, they have the tool to do that. So the ability to max all of that. And then we should never be tired of learning. And so whether you like it or not, some old knowledge are obsolete now.
So you need to upgrade your software.
You need to keep. For those of us that use smartphones, you know that virtually, almost every year, almost every week or every month,
you have to update.
You just have to update. So people, the young ones need to understand that for health, it's a lifetime of learning.
That's it.
Because patterns are changing
every day. New diseases may arise as well. And stuff.
New disease. Even if it's an old disease, but coming in another form.
How to train it.
And then also recognize the fact that in Nigeria, for example, we're over 220 million.
Yes.
Everybody presents in different symptoms. So your ability to read and pick those things. And then people should also begin to understand the fact that you can't just be you don't have to be, one of the things I see young people, you don't have to be everywhere. Take a part. I mean, we're celebrating you today. I've known you for a while now.
Thank you.
You are focused on your entertainment
Thank you, sir.
side. And so you could see how you are moving from one step to another.
next,
from
yes.
one step to another. But what you see a lot of young people do is that they are health today, they are this tomorrow, they are this next tomorrow, they are this. So at the end of the day, 10 years is gone. And whether you like it or not, by the time you are doing 10 years post-graduation, it's not the same because the energy level is dropping. Particularly if you are not seeing any level of success. So if you are
Especially
seeing
monetary success.
but if you are seeing some level of, sometimes it may be progressive success that is not monetary. Like I said, for you to make money in health, it takes time. Those training will require you to go back to school, sometimes for 3, 4, 5 years. But you need to understand that that's the sector. So
that's how it works.
That's how it works. So health is different. It's different from IT. It's different from entertainment. It's different from banking, and everything. We must understand, and people lastly must understand the industry where they are or where they want to play. And what are the critical factors or elements for me to succeed. So if you cannot understand that and pay the price, there will be no success.
There might be no way forward. Thank you so much for your time. Thank you for sparing time out of your busy schedule to honor this show. As they also say that health is wealth. Thank you for unwrapping your wealth and sharing it with us. And I hope you have a nice day.
No, I do. I mean, these are not things that happen every day, but I value this, and I believe that this would help everybody out there. Would help the country. And I must congratulate you for this bold step.
Thank you. Thank you, sir.
So we are here to support in any little
I
way
trust
that we
you,
can.
man. Yeah, thank you. Thank you. You're already doing the supporting, and it means a lot to me from the bottom of my heart. Thank you very much.
Thank you.
And thank you for coming once again.
Thank you.
You know, I'll see you around, sir.
Thank you.
Yeah. Thank you, sir.
Thank you.
Yes, sir.